Hi, I'm Dr. Scott Walton, chiropractor at Wellspring Chiropractic in North Lakes, and today I want to talk to you to one of the most common things I see in practice. We all have this bad habit of getting our head into a forward position. Now, it's typically called anterior head posture, and it's where our head starts to creep forward like this, and this ear gets more and more forward compared to our shoulder. This can actually translate to a change in the skeletal structure of the spine within the neck, and normally we should have a nice cervical curve where you can see a little bit of a C shape pointing backwards. Now, some people can get an x-ray that'll start to look like this, where their curve is so straight that they've actually lost that cervical curve. Now, in order to regain that, we do a lot of little strategies here at the clinic. We help with chiropractic adjustments, of course, but we also can give you some stretches and stuff to do that will actually help promote that curve coming back. I'm going to demonstrate one of those to you today, and it's a lateral scalene stretch. So the scalene muscles are on the lateral side of the neck. We have a posterior, middle, and anterior scalene muscle, and these can get really tight and short when we're in that head in the forward position like that. I've got Sherelle here today, and we're going to demonstrate how to properly do one of these stretches, and you can use this as a guide when you're trying to do it at home. Now, what I'm going to do today, Sherelle, is I'm going to get you to put this hand, and we're just going to tuck it underneath here, all right? So what this is doing is it's pulling this shoulder down, so that way we can get a nice stretch onto the side of the neck. Now, Sherelle's going to take her other hand, going to lift it up, pull it on the same side of the neck that we're pulling down, and pull straight to the side, okay? Now, you're going to see this is actually pulling out the tendons of the muscle right in along here, and that's that middle scalene muscle that I was just talking about. Now, we want to do 3 positions when we're doing this stretch. Now, we're going to also flex forward, okay? Now, when we stay on that lateral pull, so pull that to the side still, but we're going to flex it slightly forward. Now that's going to actually dramatically switch the muscle from that middle scalene into the posterior scalene and get that one at the back of the neck. So you'll feel that active shift when you're doing this stretch. The last position that we want to do is actually to keep that side bend going, so just like that, Sherelle, thank you, and then look up at the ceiling slightly. Now you'll really feel that stretch, and you're going to actually see the change in the muscle tendons that are being stretched, and it's going to move to that anterior scalene muscle in the front. This is the one that's commonly the most tight when we have our head in that forward position because they're in the shortest position of all. Alright, so we're just going to straighten it up, okay? Now that should feel probably a little bit tight because you've just worked an area that's always overworked, but it will help in the long run. And you should try to do 8 to 10 of those, and you want to hold for a good 8 to 10 seconds in each of those 3 positions. All right, hopefully that helps you out, and we'll see you next time.